I'd like to thank my opponent for an equally well-crafted argument. To respond to the proposition's remarks on PETA and the National Anti-Vivisection Society, while PETA undoubtedly raises awareness for the plight of animals, there is an extremely alarming dichotomy in what it preaches and what it practices, and it provides no outside sources of citations, which was my main concern. To reiterate, while all animals and humans are biologically different, we are also biologically similar. We share almost 99% of our DNA with chimpanzees. No experiment is perfect, but as Frankie Trull, president of the non-for-profit Foundation for Biomedical Research, states in Time magazine, over the past 60 years, scientists have figured out what works best in what models. Scientists really do try to go that extra mile to find the species that would most accurately mimic how the compound would work in a human. My opponent says animal testing doesn't raise the question, does it work, but rather, is it necessary? The answer is yes. Alternatives for animal testing do exist, but they are effective means of testing, but they are also extremely limited in what they can test. There's not an alternative test for every disease, every drug, every system. My opponent claims, to paraphrase the old song, anything animal tests can do, alternative tests can do better, but he provides zero evidence for that, and that's because it's not true. According to a report issued by the Pentagon this month in military.com, more troops could die if the military stops using live animals for battlefield medical training before medical simulation devices are up to snuff. The current human simulation devices, such as mannequins, used in emergency medical training, haven't been shown to have sufficient high fidelity to base medical training on. And Swiss pharmaceutical company Novartis states, despite the advancements made so far, it will still be necessary to continue to use animals for the foreseeable future. This is because the body is very complex, with all parts being interdependent on one another. As these interdependencies cannot be recreated in a test tube or on a computer, often the only way to find out if a new medicine has unforeseen effects is to test it on a living being. According to the National Institute of Environmental Health Sciences, human and animal responses to toxicants are complex and difficult to accurately assess using only in vitro systems or computer models. No single in vitro test method is currently available to serve all regulatory needs for a specific testing area. Additionally, it knows scientists are required to consider alternative methods before using conventional animal testing, which begs the question, if these methods are, as my opponent claims, so perfect, why are scientists not using them exclusively? After all, companies are supposed to make money, so why would they choose something that seems so bad for business? The reason? Alternative tests can't provide the same range of test results as animal testing. As the old adage goes, if something sounds too good to be true, it usually is. Same goes for alternative testing methods. They can be useful, but they're not capable of fully replacing animal tests yet. Again, quoting Frankie Trull in Time, at some point in the process, it's critical to understand how a compound works in the whole living system. You can't just determine how it works on blood pressure or the heart. You need to know how it would affect all the organs. People in the research community will be the first to tell you they still don't know enough about how the complex living organism works in order to duplicate it. Animal testing is necessary because medicine is about making the best treatment possible for patients, be they human or animal. Animal testing is used to treat animal diseases. If a doctor or veterinarian says, medicine A has been tested on animals and we know it works really well, but medicine B has not been tested on animals and we don't really have a scope of how well it works, you're going to choose medicine A for yourself or your pet. Whether or not there's a chance to use alternatives is irrelevant if they don't work as well and to the same extent as animal research. It's not about respecting the environment. Animal testing isn't global warming. Our moral obligation to better the lives of our fellow human beings is our ultimate and utmost concern. Animal research is crucial to creating and perfecting medical treatments, which is why the judge chose my counterplan to ban animal testing with an exception for medical purposes.